that is done, we will go to a Q&A as usual. So we'll try to get to as many questions as we can. We'll go until about 8 o'clock. If you do have a question, you can use the Q&A feature on your device there to enter your question. That helps us track them. I know that there is the handy chat there as well on the side, but we as moderators we can't follow that quite as easily. So if you could please put your questions in the Q&A, we will get to those at the end of Jen's presentation. And just very quickly before we get going here, I will just share as well that this call is a call on February 16th, 2021. This video discusses matters related to residents of long-term care homes operated by Grey County during the COVID-19 pandemic. These calls, they are public, so feel free to share the video of this call that will be made available after to others in the community who may be interested. And if you are watching this and you have a family member in a long-term care home that isn't operated by Grey County, please contact that home in regards to any questions you have about care. So with that, I will stop sharing and I will pass it over to you, Jen.
Great, thanks, Rob. And when I unmuted, I lost my notes. There they are. Okay, thanks for that introduction and good evening, everyone, on this very, very snowy February evening. So we last met virtually on January 19th, and I can hardly believe that it's been less than a month, and you will also be, won't be able to believe that either with the list of updates that I do have to go through with everyone. So I will go through it, and we may need to go back and because there's a lot of information to share today. So since January 19th, as Rob mentioned, there's been lots of directives and updates coming from the province, Ministry of Long-Term Care and Public Health. Grey Bruce has moved into yellow level for public health strategies restrictions, and we are still working through exactly what that means to us in long-term care, and we'll talk a little bit more about that as the evening goes on. While the province may be reopening, not a lot has changed for us in long-term care. All of our residents have had their first dose of vaccine, but due to shortages across the country, our staff and DCPs are still waiting. And when I wrote this, it was around 3 o'clock, and since then there's been an update. And so I do speak to that a little bit later. As of today, there are no cases of COVID-19 in either residents or staff at any of our 3 homes. The purpose of the call tonight is to provide you an update. During the call, we will provide updates on, I have an introduction of a new team member, a little bit of discussion on the new variant of concern, an update on vaccine, testing, visiting status during the changes from the stay-at-home orders lifting. So it sounds easy when I say it fast. We'll get through it. We are seeing the provincial numbers of cases consistently around the 1,000 mark provincially. In our immediate Grey Bruce region, we're seeing a decrease in COVID cases, currently with 22 active in all of Grey Bruce. That's today's report. We must recognize that there continues to be community spread of the virus and have seen the variant of concern in our neighboring regions. We must remain vigilant in our strategies to prevent infection. These strategies are our first line of defense in stopping the spread of the virus into the home. Quick overview of what we've been doing for almost a year. So active screening of every person who comes in and out of the building. Staff are only working in one facility. Staff interval testing continues every 7 days, and we have an update on what that's transitioning to. We're minimizing the movement of staff from home area to home area within the home. All staff and visitors, and now residents, as tolerated, are wearing surgical masks. So staff and visitors wear them at all times, and residents are wearing them if they're able to tolerate it in social settings. Plans are in place in all 3 homes to quickly isolate residents if needed, and we do isolate with even 1 symptom. Plans are in place to quickly move into full outbreak protocols, and all 3 homes have experienced an indeterminate test result from surveillance testing where we've tested those strategies. And we continue to monitor our PPE supply, and we report our inventory along with a number of other reporting indicators to the province. So I am going to introduce a new team member, and I'm going to share my screen. Okay, Rob, can you see Denna?
Yep, there she is.
Okay, great. So I'm really excited to introduce Denna Leach to the Grey County Long-Term Care team as our long-term care clinical specialist. Denna will be taking on the new role, and it's a new to Grey County long-term care role of clinical specialist leading our 3 care communities. She'll be leading the programs, working collaboratively with our health teams in each home, coordinating best practice and innovation that fulfills our Color Up promise for residents and staff. She is a registered nurse with a Bachelor of Science in Nursing degree and has over 29 years of experience working in healthcare. She has experience and a teaching degree and a healthcare management diploma and a master's degree in leadership. Over the last 17 years, Denna has worked in the Grey Bruce Health Unit as a public health manager and has worked closely with our area's 19 long-term care homes and has helped us by leading the fight against COVID-19. Her extensive knowledge, leadership, and practical experience will be an asset to our department, and we're really excited to have her. Denna started in her new role on February 8th, and we'll attach this announcement out with our newsletter following the call. So yeah, when life gets back to a little bit back to normal, hopefully you'll see Denna around the homes. I just need to pull my notes back up. Okay, so new variant of concern and the importance of IPAC. We are all aware of and keeping a close eye on the new variant of COVID-19. These are sometimes referred to as a variant of concern, the B117 or the UK variant. We have heard from experts like Dr. Steiny Brown, and he spoke, so he's in the scientist table, the table of experts that has spoken provincially about modeling. And what he said on February 11th was that Ontario could most likely see between 5,000 and 6,000 cases by the end of March of COVID-19, and that modeling suggests that the UK variant could rise dramatically if we aren't careful and paying close attention to our public health measures. He also warned about the very real risk of a third wave and potentially a third lockdown. And so we need to really be paying attention to the scientists and the experts when they're talking about this stuff. Variants of concern as of February 3rd were spread out over 12 public health unit regions, including Toronto, Peel, York, Durham, and we know Simcoe, Muskoka as well. So in mid-January, we were watching the terrible and tragic outbreak at Roberta Place in Barrie, now confirmed to have been the variant of concern. At that time, our 3 care communities worked closely with public health and our hospital partners to coordinate third-party IPAC risk assessments. These assessments have helped us to identify any areas that require improvement or modifications. So what we know and what we've learned is that there's nothing extra special, nothing in addition that we can do to prevent the variant. We know that it is more easily spread. And so what we need to be sure is that the strategies we have in place are as perfect as possible. And we also know that we're a year in to these strategies and measures, and people are getting tired. All of us are getting tired. Our team members are getting tired. You're getting tired. I'm getting tired. And so having the third-party teams come in, so the hospital team and the public health team, really brought a fresh set of eyes. It was nice for the teams in the home to hear all of the things they were doing really great. And there were lots of things that they're doing really great. And it was also an opportunity to see where we might be able to pull our socks up just a little bit. So we're using that information to bridge any gaps that we have. Education sessions are currently being organized also to help support our hospital staff who have put their names on the list to potentially help a long-term care home if it was to go into outbreak and have a staffing shortage. Both of these strategies will support positive relationships for allowing a more nimble and prepared staff crisis response. We're also working on outbreak strategies, implementing new COVID education resource toolkits, looking at our cohorting and how we might do that in response to the variant. Vaccination update. So this is exciting and very good news. Public Health has provided information regarding the COVID-19 vaccine and the phased-in approach. Data has been provided to Public Health, and each care community has been providing education, information, and gathering consents. All of our residents who were able to receive the COVID vaccination have had their first shot. So that's really, really great news. January 25th, all Rockwood residents, so 84 residents were vaccinated on January 25th. Lee Manor had an opportunity for a small shipment of vaccine on January 28th, and so 22 residents received their vaccine that day. Grey Gables received their vaccinations on Saturday, February 6th, where 67 residents were vaccinated, and Lee Manor on Sunday, February 7th, and the remaining 123 residents at Lee Manor were vaccinated. We received an update from Public Health at 5 p.m. today that we can expect vaccine clinics to happen over this coming weekend for staff and DCPs at all 3 of our homes. So if you're a designated care partner and you have sent in your consent, plan for a Saturday or Sunday clinic. A few important items, and we will follow with this in writing in a newsletter or an email, so you don't have to worry about getting it all right now. But a few important items. We have provided to Public Health our numbers of staff and DCPs who have given their consent. So we have your consent forms. Those doses have been saved for each of you by Public Health. If you can't attend the clinic or you've changed your mind, you need to let your home leadership team know ASAP. Once the vaccine is at the home, it cannot be transported elsewhere. So if it doesn't go into an arm, it's wasted. And our goal is to have zero wastage of vaccine. You will be contacted by your home and given a time span to attend. You'll be given an appointment time to come and attend the home to receive your vaccine. I believe that you'll be contacted by phone. You will need to have a negative COVID test result in the past 7 days. So you still have to pass screening to be able to come into the home and receive your vaccine. If you're worried that that won't be the case by Saturday or Sunday, your 7 days will have expired, then I urge you to call the home and make arrangements to be tested tomorrow or Thursday. If for some reason that doesn't work, we do have rapid antigen tests available. We are not wanting to rely on rapid testing if possible. The vaccine clinic is a finely tuned machine. So for example, the public health team that comes to Lee Manor will be vaccinating 220 people in a span of about 6 hours. So we don't want to have to hold up the process by doing rapid testing. However, we're not going to want to turn people away. So we do have that as a plan B. If you have decided that you want your vaccine, but you've not submitted your consent, don't fear. This is one clinic of many. As vaccine supply becomes more available, there will be future opportunities. It's still unclear as to how this will be worked into the phased-in approach. And so as vaccine is still in short supply across the province and across Canada, those decisions are shifting and changing, but we'll keep you up to date. So we can ask some questions after about vaccine, if there are any. So testing update. The province has told long-term care, and we talked about this a little bit in January, that we will be moving to the PanBio rapid antigen testing. There have been several updates from the province since this was first announced. The latest is that by February 22nd, our 3 long-term care homes must be providing day of rapid tests for our designated care partners. By February 28th, we must be providing staff testing 3 times per week. And by March 15th, the full program must be operational and only using PCR testing for symptomatic testing. So the PCR testing is the testing that you're having done now every 7 days. And that is a diagnostic test. It was never designed. And so now I'm foraying into clinical talk that I have no right to be doing. But what I've been told is PCR testing is for diagnostic. It was never designed to be a surveillance test. The rapid antigen testing is perfect for surveillance testing, and that can save our PCR tests for when someone has symptoms. So the direction requires all team members to be tested 3 times a week, and designated care partners upon each visit. So every time you visit, you have to receive a rapid test. Additional human resources are necessary for us to successfully operationalize this and to allow testing to be available 7 days a week with extended hours. We don't want this need for you to be tested every day or every time you arrive at the home to limit your availability to visit your loved one. Some of that depends on human resources. And so we have internal and external recruitment efforts underway right now. And our goal is to have 7 days a week, extended hours. Additionally, each home must set up an appropriate space to conduct rapid antigen testing. The space must be accessible. It must be large enough to allow for safe distancing of individuals and allow for space for people to be waiting for the results. The teams are being extremely creative to find an appropriate space that meets all of that specific criteria, but also does not negatively impact the residents or take away from their living areas. There will be updated instructions and information provided by each home as we get those into place. So the entrance might change at Grey Gables, for example. The process at Grey Gables might be slightly different than the process at Rockwood, than the process at Lee Manor. And a lot of it depends on the physical layout of the building. And we are trying to keep into account the fact that it's February in the snow belt. We'd like you to have a warm place to wait your 15 minutes. So I didn't say that. The rapid test results they take 15 minutes. So there's a specific level of staff that can conduct the rapid test. It is still right now a nasal pharyngeal. So it's the same type of swab that you are doing right now. And then it looks kind of like a pregnancy test. And so the RPN or the dental hygienist is someone that can conduct this test. And so we are looking outside the box and externally reaching out to dental hygienists, paramedics, RPNs to see if we can build our team to be able to support the rapid testing. It takes 15 minutes and you get your result. If the result is negative, you finish your screening and carry on with your visit as you did before. Because of the variant, I will remind you that we ask you to go directly to your resident's room, have your visit, do your support, and then make your way directly back out of the house. If the test is positive, the rapid test is positive, then you will be provided a PCR test, so the same test that you get right now, and we'll link you with public health, and public health supports us in giving the directions of they will guide you in how to self-isolate and what to do while we wait for that PCR test to come back. So that's a bit of an overview there, and we can talk about this a little bit more in the questions. Third-party oversight. The Ministry of Long-Term Care also notified all long-term care homes in the province that mandatory third-party oversight of active screening is now required at the screening stations. They have provided funding for this, and our current service provider of Fairmont Security will take on this role at all 3 locations to ensure that we're fully compliant. So I will link all the memos that go along with this update in the newsletter to follow this call. And there's a frequently asked question document about rapid testing. There's a memo about third-party oversight, and I'll include that in the follow-up. So don't be alarmed if you see someone that might be in a uniform at the entrance. We are going to provide them some training, and they will support the screening process, but not replace our screeners. And they will fulfill that third-party oversight requirement. Visiting status. Grey Bruce is now in level yellow of public health measures. As I mentioned earlier, we are sorting out exactly what this means for us in long-term care. While this means some things are reopening in the community, we are taking a cautious approach in our long-term care homes. We are not out of the woods on this pandemic. The new variant is concerning. Our residents have only had 1 dose of vaccine. Our staff and our DCPs are getting their first dose this weekend, and we're trying to operationalize a huge transition into rapid testing. So for the next couple of weeks, we will continue to suspend outings and day trips with the exception of medical appointments and by special request. General visits and window visits continue to be suspended. We will reintroduce window visits before we introduce general visits, but the window visits are impacted by where we're locating our rapid testing clinics. So that where the window visit is now might have to move to a different window because that's the rapid testing has taken that space. One change is that under the stay-at-home orders, DCPs could only visit one at a time, and now we will open it up for DCPs to visit two at a time per resident. And the best news of the day is that hairdressers are able to resume, and so we're working on bringing that service back into the home. And the hairdresser will also follow the same rapid testing guidelines as staff. So, Rob, that is a ton of information, and I am happy to go to questions.
Great. All right, so we do have a few questions to get us started. For those of you on a tablet or phone or laptop that you can enter a question, please feel free to put those into the Q&A feature. Unfortunately for our call-ins, we can't take live audio calls at this time, but if you do have a question that we're unable to answer, you can certainly email us after at communications@gray.ca, and we will do our best to get back to you as soon as possible. So I think I'll probably try to go through these. Let's do vaccine-related questions first, Jen, and then maybe we'll get into testing after that, if that works for you.
Yep, that's good.
Okay, so the first question is, so Toronto has a much higher rate of long-term care testing, and DCPs getting both doses of the vaccine. Do we have any insight as to why we're just getting to that stage now?
I believe that some of the distribution was linked to prevalence and that public health rating. And so the vaccine did get prioritized to the hotspot locations. And I believe that was kind of where the lag was. And then there was, when we were expecting to get it in Grey Bruce was around the same time that we were getting the province was getting notification of the shipment shortages. And so we were impacted by that.
Okay, thank you. Do we know when residents will get the second dose of the Moderna vaccine? Will they get the dose within the 42-day window? And then he goes on to say, I'd rather miss my dose so my parents can get their second dose.
I know the vaccine is, the rollout of this has so many emotional and ethical questions. And so what I believe I heard from public health today was that the resident dosing is following the Moderna and the Pfizer timing, and actually aiming for what the original timing was, like the 21 or 28 days, and not pushing it to the longer time. Staff and DCPs might be pushed to the longer time, but they're hoping for the 28 days for Moderna.
Thank you. And that is a question that we had here as well. What is the recommended timing? And just from some quick searching here, I do believe that 21 days is the ideal window, 21 to 28, but it has been approved for up to 42.
Yeah.
And just for clarification, is it the Moderna vaccine that's being provided in all of the cases?
I'm actually not sure. I need that. So my phone is, my texts are lighting up. So someone's going to confirm for me because I don't remember. It's the Pfizer this time.
Okay, so the one coming this weekend for the clinic is the Pfizer vaccine.
That's right.
Okay, thank you. Just going to see any more vaccines. Okay, it looks like maybe we're getting into some more testing questions here. So Emily asks, if a DCP visits daily, they must have a daily COVID rapid test, correct?
That is correct, yep.
Do outside workers, so contractors, Bell technicians, Mac Hall Mobility, and so on, have to provide a negative test to go into a home to do work? And what screening did they undergo?
Yes, so they undergo the exact same screening that the staff and the DCPs undergo. And so a contract worker, let's say an X-ray tech, for example, is a good example that is used by the province a lot, because it's someone that goes long-term care home to long-term care home providing support for residents. That person does need to have a rapid test every day, but they don't have to have 14. So if they go to 14 homes, they don't have to have 14. They have to have one rapid test. The province is working on a form or a bit of a passport document to help support this. But for now, they can take a picture of it and it's dated, and they show us the picture that they were just at Rockwood Terrace and they had their negative rapid test, and now they're at Grey Gables an hour and a half later, and here's a picture of their negative rapid test from Rockwood Terrace.
Okay, yes, that would make sense. 14 swabs in a day doesn't sound like a very good day. I'd be looking for another line of work. So when a DCP comes in for a rapid test, where will they be waiting?
Yeah, so we're still sorting out the logistics, and Denna is helping the clinical teams it's all hands on deck to try to sort out the flow, because we want to make sure people that haven't been screened and are waiting aren't in the resident space and aren't too close to other people that are waiting. And so we're hoping, our goal is that it will be somewhere warm, whether it's a drive-through rapid test and you wait in your car and we let you know that your test is negative and you can come in, or do we have a space where you come in, you screen, you put your stuff on, you have your rapid test, you sit and wait, you get the go-ahead, and you head into the rest of the home area and go directly to your person's room.
Okay, thank you, Jen. So looking down the road, if someone has received both doses of a vaccine, do we know if they'll still have to have rapid testing when they visit the home?
I think we can anticipate that we will need to be doing rapid testing, all of us, as either visitors or workers, for the foreseeable future. There is still research being done to determine whether or not the vaccine prevents the spread of COVID-19. It does reduce the risk and the illness that comes with COVID-19, but it may not fully reduce the ability to spread it. So until we know that for certain, I can anticipate that we'll be having rapid tests.
Thank you. So I think you did mention this, but can you just describe what rapid testing looks like? I think you said that it is still a nasal swab, correct?
Yeah, so right now the PanBio rapid antigen test is a nasal swab. Or it's a nasal pharyngeal swab, an NP swab. So it's exactly the same as what you're having done right now for the PCR testing. And then I don't know that I've had a rapid test yet. I did a PCR yesterday, but it looks like we'll see if we can send a link out of a picture of it, but it does look like a pregnancy test. And so there's one line or two lines, and that tells you if you're negative or you're positive. And the person conducting the test does whatever they do with the kit, and they squirt this and they put this in, and they get a result. So I really should have one done so that I can see what it looks like. I have heard that there are nasal swabs that might be coming, and so it's a little less invasive than the nasal pharyngeal, and it's been approved by Health Canada, but they are not yet. We do not have them yet in the province, or at least available to us in long-term care.
Okay, thank you. So you said now that we're in yellow, can you just confirm that 2 designated care partners may come in together?
Yes, and you both need to be rapid tested.
Perfect. And when do rapid tests start? When will we begin that process?
So we have to be doing day of rapid tests for our designated care partners by February 22nd. So we will send out some clarifying documents of, this is what's going to happen. This is what it'll look like at Grey Gables. This is what it will look like at Rockwood and at Lee Manor. This is where you should go. This is what you can expect. We just don't have all of that nailed down, but we are working away at it. And yes, our goal is to transition so that you don't have to be doing a PCR and a rapid test, that you can just start into rapid testing.
Okay, thank you. Do we have any rationale for why DCPs are being asked to be tested daily if they're visiting daily, whereas staff are 3 times per week?
No, the province, I would be guessing and putting words in the province, like making words for the province. That is the direction from the province. I don't know whether they expect that people aren't necessarily visiting daily. We also know that when we get to general visitors, they also will need to be rapid tested. What we don't know is, what does a general visit look like? Before Christmas and before the lockdown, general visits indoors were distanced. You had to have a negative test. You had to be 6 feet apart and masked and in a common space. We haven't received an update yet from the province on what general visits look like in rapid testing land. I don't know whether they may ease that back of the every time. Possibly it has to do with tracking. It's a challenge for us to track the staff testing and make sure that we're testing staff. They have to be tested 3 times in a 7-day window. And so Rockwood shared a phrase that was helpful, that you need to report for testing every day unless you were tested yesterday. Like it's clear like that. So I think that the province has made it every time you present to help ease the tracking and the burden of tracking. And that doesn't make your nasopharyngeal feel better, but I believe that it's to help the long-term care homes to be able to successfully have this surveillance in place.
Mm-hmm. Mm-hmm. All right, thank you. So on top of the daily testing, DCPs will need to continue with their PCR swabbing every week.
Once we transition to rapid testing, you will not have to have your weekly PCR testing. You will only need to do DCP rapid testing.
Okay, thank you for clarifying that.
Yeah.
So due to rapid testing, is there any chance that residents could have more than 2 designated care partners who take turns visiting?
Nothing is off the table. So let's see where we're at this time in March, and we'll have fully operationalized the rapid testing, hopefully being able to fulfill those extended hours and 7 days a week. And nothing is off the table. Maybe by then general visiting will be in a position where we feel more comfortable with general visiting, and then you won't need to have more DCPs because people can come in, they can be rapid tested, and they can be able to do a general visit safely. I would say that is a goal. We're just not quite there yet.
Okay, thank you. So I think this question is regarding the clinic this weekend. Is a negative test requirement for the vaccine dated 1 week from receiving the results?
Oh, geez. This is always the thing that gets me. So we just need you to pass screening because you're going to be coming into the home to receive the test. So you have to pass that active screening. And so it's the same requirement that you would need tomorrow to go do a DCP visit. It's the same criteria.
Okay, thank you. And for this weekend's clinic, are DCPs going to need to select a day to attend for the vaccine, or are they going to be contacted with this is your date and time?
Yes, we will, once public health gives us the formal go ahead, we know that it is this weekend, it's the Saturday or the Sunday, and we should have that information tomorrow and the go ahead to start making phone calls. And so it will be, this is the date and this is the time we'd like you to come.
Okay, thank you. Does the rapid test have any false positives? Do we have, I think we got into that maybe a little bit earlier on when we had public health in these calls, before before we got to the rapid testing. Can we really speak to that ourselves, Jennifer?
No, I think that I'm going to look for the FAQ and highlight some of those. We can pull those snippets out. What I've heard is, with the PCR testing, the volume of testing that we're doing, there are going to be instances still of indeterminate tests and possibly false positives and possibly false negatives, which is why the testing needs to be the 3 times or more in a 7-day window, and why we still need to be wearing our masks, keeping our distance, washing our hands, all of those W's we need to watch, even though we just did a rapid test.
Okay, thank you. Will a DCP still be able to visit their resident if they do not get the vaccine this weekend?
Yes, it won't change that. No, it won't. And I would like to add that even when we have all had our second vaccine and a period of time has gone by and we are full up in our immunity, we still need to be wearing our masks, washing our hands, watching our distance. There is a light, but it's a little bit further down the tunnel. And so we still need to be following all of those protocols.
All right. So earlier when you were talking about some of the restrictions in place, you mentioned that outings were still more or less off the table. Can you give an example of what a special request would be for an outing? Are there any examples we can give?
Sure. So a medical appointment is an easy, nice and cut and dry. So someone needs a diagnostic test that can only be done off-site. Special requests. I give everybody all the rules. I'm up for a good story of a special request. So what we do is we'll talk about what your special request is. We'll look at what the risks are. We'll do a risk assessment. So is it a family outing in a hall with 50 people and only 30 people should be there? Then that's high risk. We're probably going to talk you into something else. If it's out in a park and it's the person and the DCP and it's something, I don't know, special, then we will work with you to see what we can support. I know we have made the homes and the teams of the homes have made special arrangements around funerals, and in particular is an example that we need to help support people in attending in however we can, if we at the least virtually and at the most in person, and how can we support that and what does that actually look like?
Thank you. When I read the directive sent out by email, I thought it said that you could have a PCR test weekly or have a rapid test upon visiting.
Yes, so you did read that. And I've attended a couple of webinars with Associate Deputy Minister Hannah, who signed that memo and the FAQ, and she clarified that that is in the transition period. So the province has, in support of homes trying to operationalize this and provide a transition, a home could start by doing a rapid test once or twice a week, but you still do your PCR test. And so we're trying to sort it out so that we can transition right into the rapid testing and not require people to have to do both.
Thank you for that. Another question about the vaccine. Does the vaccine have to be from the same company as the first one? So if you get a first dose of Moderna, could the second one be Pfizer or vice versa?
I'm checking. I'm going to ask my anybody that knows this to text me, but I believe that they try to keep it the same second dose as the first dose. That's the goal, and I think they've successfully done that in other parts of the province.
Okay,
Same as what I'm getting. So thanks, guys. Yeah.
Already got that one. Do we know what is the efficacy of the vaccine in nursing home residents?
I'm gonna, maybe what I'll do is we'll recirculate the slides that the pharmacist presented at the meeting last month, because I would be guessing, because there's a little bit different. The Moderna, one is 95 and one is 93 or 92, and I just don't remember specifically. And is that what the efficacy is in groups of seniors in long-term care, or is that so it's getting to be more above my ability and skill. So let's see what I can find and we'll send it out.
Okay. Are rapid testing results as accurate as the testing we've been doing up until now?
Yeah, so what I've heard from Dr. Era at Public Health is that when used for surveillance on asymptomatic people, so all of us are not going to get our rapid test if we have symptoms, and used in that 3 times in a 7-day window, it is as effective. It's even more effective than as a surveillance tool.
Okay, thank you. And going back to the rapid testing, so I know that neither you or I can speak from experience on this yet, but do we know if it is less invasive than?
Yeah, it will be exactly the same as the PCR test for now.
Yeah.
The hope is that the nasal swabs come, and then it's a deep nasal, and then there's another combination that's nares, which is not quite as deep. So nasal pharyngeal is the farthest back, then deep nasal, then nares, but the nares also goes with a throat swab, which also sounds not very appealing to me. So nasal, I think, is the least invasive, but we don't have that available to us quite yet.
One more question I'm seeing in here now. So if you have more, we do have a little bit more time. If I can't get a COVID test done and get results back before this weekend's clinic due to work, can I get the rapid test in order to get the vaccine this weekend?
Yes, so just give a call to the home and make those arrangements, because if the home knows ahead of time that there's 3 or 4 people and then a handful of others because of snow or this or that or whatever, we can accommodate that. We just don't have enough resources to rapid test everybody and support the vaccine clinic. And I will share that the vaccine clinic, it's a team from public health, and the public health nurses give the vaccine, where with the residents, the public health nurses drew up the vaccine because they have the super skills at being able to get that extra dose. If it's drawn up properly, they get that extra dose out of the bottle. And then our team members gave the residents the shot.
Good. I see we got another one here. The general public cannot be trusted to be honest about behavior and context. Therefore, all the tests. This also includes staff. COVID gets in from the outsides of the homes. Is this true?
Well, our residents are the common denominator that are not going anywhere. So if we bring any sort of infection or anything into the home, it's people coming in that are bringing it in. And so that's why it was so important that we have some fresh eyes support us with our infection prevention and control measures. It isn't complicated, those measures. They just need to be, we need to be doing them properly all the time. So making sure we're screening and supporting staff to not be at work if they have a symptom, that we are washing our hands and wearing our PPE properly, and noticing when we clear some dishes that we wash our hands with the hand sanitizer before we do the next thing. Just all of those little moments are really important.
Mm-hmm. Yeah, I think that's very well put, Jen. And I think that we do also need to remember that we can all, I think we're all trying our best. We're trying to follow the 3 W's that Dr. Era is talking about with washing your hands, watching your distance, and all of that. But community transmission is a term and something that it does just happen. You don't necessarily need to be irresponsible. It just takes letting your guard down for a moment in the wrong situation, and it can happen. So that's why we need all of the testing, and we do need to be very cautious. At the clinic this weekend, will DCPs get some form of documentation to confirm that we have received the vaccine? Is that anything in our realm, or is that a public health thing? I imagine
that's public health, but I think so. I don't know. I wanted to get buttons, but there was so much going on. The ordering of buttons fell off the side of my desk.
I think that's quite understandable.
Oh, I'm being told by the experts that know this stuff that you will get a document and it gets emailed out to you. So that's good.
Perfect. There you go. Given the efficacy rate is 92%, does that mean that we'll always need to practice COVID precautions in the future? Do we have any insight into that? Maybe
yeah, I have no actual skilled ability to answer that question right now, but and I think that we'll take some of these questions and invite Denna to attend a family call and be able to answer, help us work through some of these more clinical questions. I think we can expect to be using our IPAC measures for a long time. I was looking at the picture at the beginning when you of the call when it said it was Rockwood Terrace, and I could see a resident in the background, and it was the good old days where he was sitting on a bench and he didn't have a mask on, and there was no thermometer nearby. And so I think that we'll always be thinking back to those good old days when we used to like stand shoulder to shoulder with people. I think this is the way it will be for a while.
Yeah, I think we've learned things just in general from this. The most Canadian example I can think of I heard today is that Tim Hortons is getting rid of the roll up the rim cup lids forever. It's going to a digital only thing, but I can kind of understand why you might not want to hand something that was in your mouth to a frontline food service worker to get a free coffee. There might be some conflicts there.
Yes.
I'm not seeing any more questions in the question bank here. So we do have a couple more minutes. If you do have something, enter it there. But I took a couple of notes tonight, Jen. So jump in if I get any of this wrong, but I just made some notes of some of the main takeaways that I heard from your update this evening. So the good news, vaccines or clinics are coming this Saturday and Sunday for staff and DCPs at the 3 homes. You must have submitted a consent form already, and you will need to have had a negative COVID test within the last 7 days. And if you can't make it, please do tell public health, so that we know you're not going to be there, so that the vaccine does not go to waste. And future opportunities will be available as well. How'd I do on that one so far?
Yep, that's good.
Okay. In-home testing, some changes. So the weekly tests are still required, and starting on the 22nd, so that's this coming Monday, rapid testing will be required by DCPs every visit. The wait takes about 15 minutes. We're going to be offering that 7 days per week, and we're going to do our best to extend hours to accommodate that for DCPs so they can visit their loved ones. We will allow 2 DCPs in per visit. And in the event that a rapid test did come back showing a positive, we would do a PCR test on the spot and then connect with public health.
Yep.
Good on that one. Okay.
Yep.
And then just as far as visits, general visits and window visits, we are remaining cautious. So those are going to be remaining suspended for the time being. And hairdressers are coming back into the homes now that we're in yellow.
Yes.
Okay.
I'm finally, it only takes me 10 meetings to get on the hairdresser bandwagon and have that information ready for people.
I think we have one more here. Maybe we can address it. So this attendee is concerned about mental health of all residents during this time. There's been no activities for them and they're missing their families dearly. This rapid testing should allow for more families to come in. Only having 2 people able to go in is exhausting, and it does put a lot on those 2 people. Is there any comment you'd like to make on that, Jen?
Yeah, I think that you're right. Being a caregiver and particularly a designated caregiver is a big responsibility, and we appreciate that. There are lots of activities going on in the homes. However, they're not always every resident's cup of tea. So if you're concerned about your loved one not participating in activities, I urge you to reach out to the resident family service manager at your home and have a good conversation about what the opportunities might be for your resident. That is the goal of rapid testing, is to be able to expand the general visiting and help share that responsibility of supporting a resident in long-term care. And so that's our goal, and we will get there.
Thanks, Jennifer. A couple more did float in here. Can we comment? Where to go? At what point will we know what the extended hours will be for?
No, and we don't. So we're doing our recruitment. I know if we are in a position where we're needing to limit the hours because we just don't have the human resources to the staff to do the swabbing. I do this for swabbing. I don't know that it's actually, it doesn't seem like that when I have mine done. If we have to limit the hours, the homes are looking back to see what hours are people coming in. So we want to try to be able to accommodate so that if you were to come in and support your person at bedtime, how early could you be able to make it in and have a rapid test, and then you can stay as late as you want. So our goal isn't to start that. We're hoping to have extended hours that work for people and what they're doing and why they're coming into the home. So we're still working through that. I got a note from Lee Manor that so there is still some unknown around how we're operationalizing these rapid tests. So if I've said something that wasn't exactly accurate date-wise for one of the homes, we are sending out a notice to everybody that will clearly outline for Lee Manor, the date is this, and this is where you present at the home, and this is what it will happen, and we'll do that for each of the homes. It's been a challenge to figure out how to do this.
Mm-hmm. Yes, I'm quite sure it's a very, very large undertaking, and you want to make it as efficient as you can. And there is another comment in here that from someone asking when are staff getting their tests? Is it when they arrive to work? When would be a good time to visit to work around that? That's something we need to consider as well.
Yeah, that's a good idea. And so the guideline from the province is as soon after they start their shift as possible. So we are trying to look at that surge time and making sure we don't have staff bottlenecked, and wait and not on the floor helping residents, and how can we balance that?
And so, one more. Will designated care partners be permitted during meal times, or is that still not permitted?
That's a good question that I'll need to get back. I do believe designated care partners can support their resident at meals. but they can't eat with their resident. So we're not quite there yet. The DCP needs to remain masked when their resident doesn't have a mask on and is eating. But if that feels wrong to you, then you need to email me or give your home a call.
Okay. All right. Well, if we didn't get to your question, just a reminder, you can still email communications@gray.ca, and we will do our best to respond to you as best we can. And that isn't just immediately following these calls. If there's things that you think of between calls, by all means, and contact your home if there's anything in particular regarding your resident, your family member and loved one. Yeah.
Sorry to interrupt. The team did just clarify for me. So you as a DCP, you can support your resident in their room for a meal, but because of the layout of the dining rooms, we don't have extra DCPs and residents in the dining room. It's just too tight of a space. So apology for that mix up there.
Okay, well, thank you very much to our extra eyes and ears out there for the help on that one. I see a few nice comments here regarding staff. You all rock, especially Grey Gables, where our loved one is. Rockwood Terrace staff have done an incredible job creating a ring of protection around the residents. Thank you. We really do appreciate those comments, and we try to pass them on as much as we can to staff. It is fuel for the front line, as they say. We are pretty much at 8 o'clock here, Jennifer, so I will pass it back to you. Is there anything you'd like to end with tonight?
Okay, I just again want to thank everyone for being so engaged and so candid with your questions. It really helps us make sure we're on the right track and doing what is right, not just to keep people safe, but also for everyone to be living a life worth living in a pandemic, in a long-term care home. So thank you all so much. We really appreciate the support.
All right. Thank you, everyone. Have a great night.